I had been doing spinal decompression in my clinic for a few years and getting great results in patients with degenerative disc disease, stenosis, herniated bulging discs, and neuropathy. But that is a procedure that's done in the clinic for about 30 minutes, and then the patient has to leave the clinic, right, and go home. But in my mind, I was always thinking that if there was a way that I could keep the patient under decompression until I saw them again, that would be an ideal situation. And I was at a medical trade show, and I was looking at all the new things, and I came across a booth of disc disease solutions. And they had a belt that I'd never seen anything like before, where you didn't focus on compression, where you're trying to squeeze the banana, as I say, but it was based on decompression, where the patients would wear the belt, use a pump to inflate the belt, and the belt would spread apart and take the spine and decompress the joint, remove the pressure off the disc so that the disc could heal. It was very similar to what I was doing in my practice with a lot of expensive, heavy equipment. And I thought, man, this is really unique. This could be the answer. At first, what I did was I just gave them to everybody who was doing the clinical procedure. And they would wear this belt basically while they weren't in the clinic until I saw them the next day. Right away, I noticed a sizable difference in results with the patients that were wearing that belt, versus patients that were wearing normal compression belts. I mean, it was dramatic. I mean, it was like 50% more improvement wearing the DDS decompression belt versus not wearing that who got treatment. So very quickly, I switched over and I started to just automatically assign these decompression belts to all my patient base. And then something interesting happened. Sometimes I get patients that are not good candidates for the in-house clinical decompression therapy. They could be patients that have had back surgery before, and there's a lot of scar tissue, or they could have rods and screws in their back. They could be really overweight and not be comfortable on the table, or they could just be so sick that a mechanized decompression therapy is just not something that they can do. So I started to assign those tough cases the DDS decompression belt and keep track of how those people did versus the people that got regular in-clinic spinal decompression. And I mean, it was just amazing. The results were incredible. And what's unique about the belt is that now we get dynamic decompression. So in my clinic with in-house decompression, it's static. They're on a table in one position and we're decompressing the spine, and that works fine. With the belt, with the DDS decompression belt, they're able to wear the belt, decompress the spine, and then put that spine under range of motion. Walking, moving. And walking is the natural process by where we activate the pump mechanism, which is what brings the fluid in and out. So, you have these discs, your disc may be, this big, right? You hurt your disc and it's under pressure and now it's compressed. We restored back to that pre-injury state, and the DDS spinal decompression belt allows us to get those vital fluids back into the disc so that that patient, here's the key, they can become as good as they can be. With the DDS spinal decompression belt, they're not restricted. They can put it under their clothes, it's form-fitting. They can have it on and people don't even know they're wearing it. They can wear it through all their normal activities. They can wear it at work. I have a patient who works at a dollar store, these dollar general stores. She's standing all day. She just puts it on under her clothes. Nobody knows she even wears it. A lot of these belts are not decompression belts, even though they may look the same. They're compression belts. The belts go around the waist. They pump up, but all you're doing, it's like inflating an inner tube around your waist or a tire tube. You're just inflating and causing compression. The difference is with the DDS spinal decompression belt, there is a patented network of cells in the belt, so that when you pump it up, it fills up a certain way. It fills up essentially from the center out, and then when you let the air out, it defills or it decompresses in the opposite way. So what the belt does is, as you're pumping it up, is it spreads open, and it takes the spine and it doesn't squeeze the banana. It decompresses and lifts the spinal vertebra, reducing pressure. No pressure, no pain.